This is a radial bone. Now, side determination of the radial bone. First of all, it has a round neck that should face upwards. Now, it consists of a sharp border, which is the medial or interosseous border that should face medially. And posteriorly, there is a tubercle, which is known as Lister's tubercle or dorsal tubercle of Lister. It should face posteriorly. Now, coming to the features of the radial bone. First of all, it consists of an upper end, a shaft, and a lower end. Upper end consists of a round disc-like head that articulates with the capitulum of the humerus. Then comes a constricted neck. Then there is a radial tuberosity. Then here is the medial interosseous border, which is the most important feature of the radial bone. Then in posteriorly, also anteriorly, there is an anterior oblique line. Now posteriorly, there is a posterior oblique line. And on the lower end of the radial bone, there is a Lister's tubercle, or we could say as dorsal tubercle of the Lister. Also, there are 4 grooves located over here. Then medially, there is also one notch for the articulation of the ulna, which is known as the ulnar notch. Now, inferiorly, there are 2 surfaces. First of all, medial quadrangular surface and a lateral triangular surface. This medial quadrangular surface articulates with the lunate bone, and this lateral triangular area articulates with the scaphoid bone. Therefore, the radius bone consists of 3 borders: an anterior border, a posterior border, and the sharpest border, which is known as the interosseous border. And therefore, it consists of 3 surfaces: an anterior surface, a posterior surface, and a lateral surface. Also, this is the styloid process that should face laterally. So, with this, we have completed the features of the radial bone.